Can you come in for a few things?
All right, everyone. Well, good afternoon. Thank you so much for joining us on this Wednesday for our February 2024 BHAG meeting. If you all would continue introducing yourself in the chat, we have a fun mindful minute question for you all to answer today. And if you can introduce yourself with your name and organization. So today, what we hope to accomplish, we have a wonderful partner presentation coming from Miss J.B. Moore with the National Alliance on Mental Illness. We will have some community announcements and announce some exciting upcoming meetings, and then we will adjourn for the afternoon. And with that, I want to take a quick minute to recognize any new faces we may have with us today. If anyone would like to come off of mute and introduce themselves, their organization, and offer their response to our mindful minute question.
Good afternoon. I'll go first. Good afternoon. My name is Jasmine Jones Edwards. I am the Executive Program Director here at Volunteers of America, the Hope Center in Maryland and DC. We provide behavioral health, mental health outpatient services for all ages, including individuals that are, of course, insured, uninsured, and also undocumented. So we do not turn anyone away for mental health, behavioral health services.
Thank you and welcome, Jasmine.
Thank you.
Good afternoon. I'm Cheryl Maxwell, the Black Mental Health Alliance. I've been around for a while, and then we had the COVID and some other things happen, and we've had a change in leadership here under kind of new management. As I was telling Taylor, it's good to be back and good to see all you guys. Oh, by the way, I'm director at the Black Mental Health Alliance of a nationwide database that we maintain of psychologists, psychiatrists, therapists, and counselors, and that's nationwide.
No, it's not. Ain't no such thing as a nationwide database.
Oh, just want to remind folks, if we could mute ourselves when we are not presenting, that'd be wonderful. Thank you so very much. Any other folks who wish to introduce themselves this afternoon?
Yes, good afternoon, everyone. My name is Dominique Scott. I serve as the Director of Development for Volunteers of America, Chesapeake and Carolinas. And I have heard about this group and wanted to join to let you all know that we have a GOAT, Greatest of All Time, Youth Mental Health Expo taking place on May 18th at Bowie State University. This is obviously, I see some heads nodding, this is obviously a great group to connect community with resources and help our young adults understand the possibilities of the world around them as it relates to their mental health triangle. I'll drop my information in the chat. I'll be on this meeting until 3:30, in which case I actually have a committee meeting for that event. But we look forward to seeing you all there if you're able to join us, and thank you.
All right, and any other introductions for the afternoon? All righty. Well, we will go ahead and get started, but first I'll introduce myself. My name is Taylor Palmer, and I'm with the Prince George's County Health Department, and it is an honor and privilege to support Nina and Margaret with the BHAG here today. And always. So thank you all again so much for joining us. And we have a very exciting partner presentation coming up this afternoon. So Miss J.B. Moore coming from the National Alliance on Mental Illness. So Miss J.B. Moore is a veterans and mental health advocate, currently serving as the executive director of NAMI, Prince George's County, Maryland. Formerly, she served as a manager of NAMI's National's Military and Veterans Policy Program, where she was responsible for supporting mental health advocacy efforts aimed at improving lives of military members and veterans affected with mental illness. She is a family member and legal guardian of a loved one facing a serious mental illness. Ms. Moore, you have served You've served our country and you have served so well with NAMI. And thank you again so much for joining us today. We are very fortunate to have you in our presence and we are looking forward to your presentation. So I will go ahead and start sharing your slides.
Thank you, Taylor. Can everyone hear me?
Yes, we can.
Wonderful, wonderful. It is an honor and a privilege actually to present today at this BHAG meeting where all of these distinguished members are with so much information to share. I really appreciate this opportunity. As Taylor said, I do serve as the Executive Director for NAMI Prince George's County and have been doing so for a little bit over the past 4 years. Next slide, please. So I want to start with telling you a little bit about how we began. Some of you may know our story. In the early 70s, there were some parents who had children that had severe mental illness and their children weren't getting the care that they needed. And so the parents sort of just got around a table, started all in Madison, Wisconsin, and decided to figure out how they could best advocate for their children. It started as a small group of people, but then it spread across the whole United States and became a movement. So today, this peer support movement has grown tremendously. The organization, in fact, is national. It is an enterprise. We have state organizations in every state, and within the state, each state, we have local affiliates. And that's the one I head up here in Prince George's County. Next slide, please. So the National Alliance on Mental Illness is the nation's largest grassroots mental health organization, dedicated to building better lives for the millions of Americans affected by mental illness through peer-led advocacy, education, support, and public awareness. Those are the 4 pillars of everything that we do. And we do it with the support of dedicated volunteers, grassroots program leaders, and other volunteers. We have volunteers who help us with a lot of different things, but some of the volunteers we call program leaders because they are trained specifically to offer NAMI signature programs. Next slide, please. So a little bit about peer support. I know this is a busy slide, but it's very important to just kind of set the groundwork here. At its core, the peer support approach assumes that people who have similar experiences can relate and can consequently offer more authentic empathy and emotional validation. So what is emotional validation? Basically, that's the process of learning about, understanding, and expressing acceptance of another person's emotional experience. It is an extremely valuable tool when responding to a mental health crisis. As a mental health intervention and recovery model, peer support has proven to decrease hospital admission rates, decrease hospital readmission rates, increase hospital discharge rates, evoke feelings of empowerment among participants, and improve social support and social functioning. And these are some of the primary keys to success. The fact that people who are involved in peer support, they begin to have this personal resourcefulness and feel that they can. It's like an I can attitude. They begin to get empowered. Studies have shown and strongly suggest that peer support may cut down on emergency room visit utilization, thus saving healthcare costs. So that's a major piece here because anything that is less cost for local governments and state governments is a plus. Peer support services are especially critical when individuals with significant behavioral health issues lack adequate resources, when stigma continues to be an ongoing challenge, when residents still need help navigating the behavioral health system, when many residents are still without health insurance, and when culturally competent behavioral health providers are in short supply. Now, according to a 2021 RAND study commissioned by the Prince George's County Council, the above conditions exist across Prince George's County. Next slide, please. Some statistics you probably are aware of. I'll just highlight a few here. Mental health conditions are common. Nearly 1 in 5 adults in the United States experiences some form of mental illness in a given year. 60% do not receive the treatment they need. Large number. 1 in 24 has a serious mental illness. 1 in 12 has a substance use disorder. Nearly 1 in 5 children experience a mental health issue, but only 20% receive treatment. Roughly 6.7% of the population in the US suffer from major depressive disorder. And with respect to suicide, typically the result of a mental health condition, it is the leading cause of death in the United States. Next slide, please. So I mentioned that NAMI Prince George's County is the local affiliate. We serve the entire Prince George's County, all communities therein, and our mission is to help improve the quality of life for the residents of Prince George's County, Maryland, impacted by mental illness. For the past 4 years, this is something I just want to note because at the bottom of the slide, you'll see a little seal, a little circle with the number 23 in it next to the page number. That denotes that we've been designated as one of the most highly trusted critical nonprofits in the greater Washington region by the Catalog for Philanthropy, which is now branded Spur Local. Thank you. I see a little clapping hand. Next slide, please. So now a little bit about our programs and services. As NAMI began to grow, I told you it kind of got started in the early 70s. As it began to grow, and after it kind of got its advocacy programming underway, it began to develop like some classes because they felt that people needed to learn more about mental health. Like what is it? What is it not? What are the diagnoses? What are the signs and symptoms? How do you help someone? How do you improve your coping skills? A lot of different things they felt that the average person just didn't know, and they wanted to create classes for them. They created classes. They also created presentations, because one of the best ways to raise awareness is to share your story. They also created support groups. We have support groups that are just for family members impacted. We have support groups that are for individuals who themselves have a diagnosis. Our classes offer information, resources, and community support. They help increase understanding of mental health, improve coping skills, and empower participants to advocate for themselves and their loved ones. NAMI presentations offer audiences the opportunity to hear stories of direct experiences of the impact of mental illness on individuals and their families. Our presentations help to create awareness, reduce stigma, and increase empathy. NAMI support groups offer participants an opportunity to share experiences and gain support from one another. Many of NAMI's programs, signature programs, are evidence-based. And what that basically means is they've been studied by an external researcher, and the results of the study are published in a peer-reviewed journal. Next slide, please. In other words, they work. Our message is clear. You are not alone. Treatment works. Recovery is possible, and there is always hope. Next slide, please. This slide here shows our impact report for calendar year 2023. I'm not going to read off every single thing, just letting you know that this is some of the data we collect and track and analyze, and that would be our support group data, like how many support groups we hold, how many sessions, how many participants are in them, how many do we hold for families, how many do we hold for consumers of mental health services themselves, and also we track volunteer hours because our program leaders, volunteers, they invest a lot of time in helping us to host these classes and support groups. We also do a number of community outreach events. Typically, individuals or organizations in the community reach out to us and ask us if we could participate in events that they are hosting. We host tables at those events, share information, resources, get a chance to connect with the community. It's a good way for us to kind of attract volunteers and new program leaders. So last year we participated in at least, I would say at least 19. These numbers, if they're not exact, they're lower than what we have done. We had a change in program coordination last year, and I just think these numbers probably in reality are a little higher, but we still touched, in terms of number of participants during community outreach, over 2,000 residents. We do implement a helpline. NAMI Maryland, I'm sorry, not NAMI Maryland, NAMI National has a wonderful, superb hotline. They are well resourced to service individuals, and we do point people in that direction. But at times we are able to service calls and respond to emails when people reach out to us in the county. Also, the national office, if they receive calls or emails for people trying to navigate the mental health system in Prince George's County, they'll refer them to us. Next slide, please. So in addition to the programs we just discussed, or I just told you about, we're organized in such a way that we have these huge initiatives that we kind of like build our work around. The first one I want to share with you is a relatively new initiative. It is supported by NAMI National, who gave us a nice grant so that we can begin to build our infrastructure, our capacity, which was severely impacted after as a result of COVID, and we are still struggling to stand firmly after that experience. So what we've done is we've sort of identified some areas where we could focus our attention and develop them. One is in the human resource area. It was very challenging after COVID to kind of identify human resources, keep human resources, whether they were paid or volunteer. Also, communications. It's very important to be mindful of our branding. NAMI has worked hard for its branding. It's a very reputable branding, and we need to make sure that that's something that we adhere to, because people rely on it when they see it, and we want to make sure that we stay closely connected with it. And that's why we want to focus on some marketing and communications. And so we have started this initiative, and it's going to last all the way throughout this year. Advocacy program. This program really is our bread and butter. It really is the programs that are NAMI signature programs, you know, the support groups, the family-to-family classes, the peer-to-peer classes. It also includes some outreach to hospital psychiatric units when individuals are being discharged. We put packets together for them to give them some information to show them what's available in the community. This program also covers meetings that we hold. Board meetings meet monthly, and then we do annually an education forum in addition to an awards program. And this program is heavily supported by the health department, local behavioral health authority, with additional support from the county council as well. Another program we implement, we short title it Elderly Program. Actually, it's our outreach and education activities to individuals who are older adults and the people who serve them. So we may provide training to the older adults, to people who are their family members, their caretakers, providers, even community agencies that service them. And in addition, we offer mental health first aid in this program. We offer the core program, mental health first aid, as well as the one that focuses on those who serve youth. The next initiative, shortened title, System of Care Children's Mental Health Initiative. This is a federally funded project by SAMHSA that's coming by way of the Prince George's County Health Department, and we are appreciative for the opportunity to participate and to support it. What we are going to be providing is evidence-based mental health related peer support programs and services that benefit families in Prince George's County that are caring for youth between the ages of 0 and 21 and who are impacted by mental illness. And the last here initiative we have hasn't really even gotten started yet. We're happy that this grant was awarded recently to Luminous Health as a result of the Maryland Consortium grant. We will be supporting Luminous Health by implementing a program we call Ending the Silence, where we go into schools and we teach children as well as parents and school staff members about mental health, the signs and symptoms, the different diagnoses, how you communicate and all those kinds of things. So we are fortunate to have this opportunity. Next slide, please. So NAMI Walks, many of you may have heard about NAMI Walks. It is our signature activity that we do annually. We do not lead it up. Our state organization does, which is NAMI Maryland, located in Columbia, Maryland. And we support it just like the other affiliates across the state of Maryland do. And we support it by reaching out to our communities and seeing if anyone is interested in participating by creating a walk team or just signing on to a team that's already signed up. And we raise funds. We raise funds so that we can continue to do the great work that we're doing, and also so we can raise awareness. Very important to raise awareness, but also we build community by doing so, by reaching out to the various partners, our family, friends, and all those who support our work. The walk is annually, as I mentioned. This year it will be in June 1st, and we'll be at a new location, Hunt Valley Town Center in Cockeysville, Maryland. Never heard of it, never been there, but I hear it's a very nice place. And there's a link at the end of this slide where if you're interested in registering for the walk, please feel free to click that link, or at the end of the presentation, I'll tell you where you can go on our website. Just to let you know about the walk last year, because I said we do it every year. In 2023, we had 6 teams. We had 38 participants. We raised over $12,000, and volunteer hours totaled 152 plus. Next slide, please. The other huge event that we do annually, and again, we don't lead it up, it's a state effort, is Advocacy Day, and it was held already for this year, February 7th, even though the legislature is still sitting. We did a virtual one. We have our priorities. 2024 priorities include early intervention, access to treatment and services, reduction of racial health disparities, and also strengthen Maryland's mental health crisis response. Very important to us. And our goal is to increase mental health services throughout the state, reduce the stigma associated with mental illness, and support effective treatment and recovery programs. Basically, advocacy works. It makes a difference, and our stories matter. Very important, our stories matter. Last year, 2023, we had more than 35 participants in our Advocacy Day. It was virtual last year as well. We targeted bills, of the targeted bills passed, 5 of them passed both the House and Senate. And of the bills we supported, 5 passed the House and Senate, and then we supported another 20 other bills. But it's a huge effort. It gets a chance for us to connect with the people that we serve, and for everyone to kind of come out and advocate and meet their legislators, and also share their stories, because the legislators need to hear from us. They tell us all the time they need to hear from us, and our stories really make it real. Next slide, please. And speaking of telling our stories, I ran through those slides rather quickly. I'm going to share my story briefly, and then I'm just going to open it up for questions and comments, okay? Thank you. So, serious brain disorders affect 1 in 5 families in this country. Mine is one of them. I was raised in a close and loving family in Harlem, New York, during the 60s and 70s, in a community rift with violence and poverty. My family lived just walking distance from the legendary Apollo Theater on 125th Street, on a block sandwiched between Junkie's Paradise and Dead Man's Hill. Untreated mental illness in my community was familiar and appeared to be the result of or cause of drug abuse. Undiagnosed dual diagnoses were sadly in generous supply. My immediate family consisted of a single mom who worked evenings cleaning Time and Life building in Midtown Manhattan, an older sister and a younger sister, and myself. I do not recall living in fear or being without. In fact, I have fond memories of belonging to a rich culture where possessing survival skills and being resilient were par for the course. My younger sister and I were raised almost as if we were twins. We were two peas in a pod. Our mother dressed us like twins, even though we were 2 years apart, and sent us off to piano and ballet lessons together every Saturday. We were so close, and everyone always referred to us as Jeannie and Ruby, as if we were one person. My sister cared about her appearance. Every hair on her head was perfectly styled, and her slender body was always neatly clad with the latest styles. My sister was loving and somewhat of a brat, since she was arguably my mother's favorite child. My sister was remarkably smart, but cared little for formal education. She seemed to live a carefree life, always in the present. My sister was very creative and talented. She enjoyed drawing, cooking, acting, and singing. Growing up, my sister and I invented a game of make-believe called Eartha. We dressed up and acted like grown-ups. We discussed details of our hoped-for husbands and children, and all the exciting things that we would do together once we were adults. While my sister and I were very close as children, when we grew into teenagers, we began to grow apart and argued often. We had a different character of friends and engaged in different types of activities. My sister developed extraordinary street smarts, enjoyed an active social life, acquired a boyfriend, and reportedly dabbled in drugs, including powerful hallucinogenic drugs. In 1979, my sister gave birth to her first of 3 children and began exhibiting signs of postpartum depression. My sister appeared depressed and withdrawn. Shortly thereafter, she had her first of many subsequent psychotic breaks and was subsequently diagnosed with having paranoid schizophrenia, a serious mental illness that interfered with my sister's ability to think clearly, manage emotions, and make decisions and relate to others. I later learned that this diagnosis is a complex, long-term medical illness affecting about 1% of Americans. Research suggests that schizophrenia may have several possible causes: genetics, environment, brain chemistry, and substance use. For our family, each of my sister's episodes of psychotic behavior was frightening and traumatic. The impact of my sister's mental illness on our family has been most traumatic, leaving a trail of destruction in the path, including stigma, discrimination, unfulfilled dreams, broken families, and broken hearts. After the onset of my sister's mental illness, communication with her became very challenging. It was difficult for my family to communicate with my sister without her feeling under attack. My sister began to engage with family and friends less and less. Eventually, my sister moved away from the city to live in the South with our grandmother, where historically there is a chronic shortage of mental health professionals and little to no culturally competent or culturally sensitive behavioral health services. My sister exhibited a severe lack of insight and lack of awareness of her diagnoses, and thus rejected it. As a result, she was non-compliant with antipsychotic medications prescribed to treat her condition. As her illness progressed, my sister gave birth to 2 additional children for whom her mother-child bonding was impaired, and my family and I provided care. For more than 30 years, my sister cycled in and out of hospitals, group homes, assisted living facilities, jails, and sometimes the streets before she began to receive the treatment she needed. Today, my sister resides in a secure memory care unit in North Carolina, sorrowfully with little to no prospects of living an independent life. Her thought processes continue to be significantly impaired. She often expressed anger towards our now deceased 96-year-old mother and routinely states that I am not her sister. My sister does not express a desire to interact with anyone. She simply wants out of the assisted living facility where she resides and a return to the rural town where she previously lived to live on her own. She continues to exhibit delusions and is less likely to engage with those who love her and care for her. As a family member of a loved one living with a serious mental illness, I felt a sense of guilt and hopelessness for many years. After significant challenges navigating the mental health system, a very rough terrain, I learned of the National Alliance of Mental Illness, NAMI, in 2012, the nation's largest grassroots mental health organization dedicated to bringing better lives, building better lives for the millions of Americans affected by mental illness. I learned that what started as a small group of families gathered around a kitchen table in 1979 has blossomed into the nation's leading voice on mental illness. I came to know NAMI intimately as a movement fueled by the personal and traumatic experiences of all communities, of residents of all communities impacted by mental illness, for the purpose of engaging in positive action and creating positive change to improve the quality of life for individuals impacted by mental illness. Again, our message is clear. You are not alone. Treatment works, recovery is possible, and there's always hope. Through NAMI's signature classes, I received information, resources, and community support. The classes helped to increase my understanding of mental health, improve my coping skills, and empowered me to advocate for my loved one. I now feel blessed with support, comfort, strength, the ability to cope, and the courage to heal. Most enlightening on my journey was learning that by age 24, 75% of all mental illnesses are diagnosed or present. Therefore, early treatment is key for recovery. Early treatment for my sister would have greatly improved her chances of managing her illness, reduced her psychotic episodes, and set her on a path to recovery where independent living may have been possible. Early treatment intervention would have allowed my sister the opportunity to live a meaningful, productive, and enjoyable life. Since early treatment is no longer available for my sister, I am most passionate about advocating for early treatment for individuals who experience their first episode of a serious mental illness. Growing evidence shows that when people get help early, it can reduce the long-term symptoms of their conditions. Getting help early means providing connections to care, identifying symptoms of mental health conditions early, and intervening with evidence-based and effective treatments as soon as possible to help an individual get well and stay well. Thank you for listening to my story, and now open up the floor for any questions or comments. That's my contact information in case anyone prefers to reach out to me. Please do so. Please feel free to do so. Thank you.
Hi,
Thank
this
you
is
for
Kelly. Could I ask a couple of questions before you go?
Oh, sure.
You referenced your sister is living in a memory unit and she's in an assisted living. Is that what you said?
I did. That's a good question. And yes, she is. My sister, and it's a very good question and very good listening, because my sister, because of her serious mental illness and because of having anosognosia, where she doesn't recognize her illness, I couldn't like manage her care. I'm living in Maryland. I'm living in DC. I was living in New York. She was always in North Carolina. I'm going back and forth 2 and 3 times a month sometimes looking for her. So there's a lot of story not here, but eventually, and repeated hospitalizations, and at some point, a discharge social worker decided to find placement for her in a memory care unit. And the director of the place told me on one occasion, there's really nothing wrong with her memory. However, you know, it was the only way to kind of ensure that she had a roof over her head and food and she was safe. So it created a problem for us for a long time because I wasn't sure if that's something I felt really that comfortable with. but I know where she is. She's safe, she's alive, and I can continue to see her.
Well, assisted
Jake.
living units are very cost prohibitive for many families since they're only cash. So I just wondered if I understood you correctly. Many of them end up in nursing facilities in memory units because they can be covered through, Medicaid. And so then my next question is,
It's a
NAMI
memory
talk.
care unit. I'm sorry, it's a memory care unit in an assisted living facility
Well, I understand that, but assisted
that
living
does that does accept Medicaid.
You're very blessed because that's very rare.
Yeah, I thought so too.
Very rare. So then my next question is, NAMI does community education, and you were talking about different areas that you go into. Has NAMI ever considered doing any kind of behavior programs within nursing homes? I work for the Quality Improvement Organization for the state of Maryland that's funded through the Centers of Medicaid and Medicare Services. So we're a free, no cost consulting service for processes improvements and quality in healthcare. So my question is, well, the question we've been getting a lot is from nursing homes on how to manage behaviors with short-term and long-term care residents that they have taken. So is NAMI considering doing anything in the nursing home sector, or do you know?
Yes, I'm speaking for NAMI Prince George's County because the elderly program that I told you about earlier, well, for older adult outreach, that's an activity that would certainly fall within the parameters of that program. And, if possible, I could follow up with you and figure out how we can get some training in any of the facilities that you're interested in us coming to.
Outstanding. I'm sticking my email in chat.
Okay.
JB.
Yes, ma'am.
Your story regarding your sister is very touching. My cousin, unfortunately, her mother suffered a mental breakdown years ago when she was a resident in Philadelphia. Her father took my cousin to a movie, and she, at the time, was 4 years old. He left her there. And my cousin was then put into the system. Unfortunately, when we years later found where she was, and we were able to bring her here to the District of Columbia, because, HIPAA cuts two ways. It certainly protects patients, it protects clients, but by the same token, it makes it very difficult for a family member who was not initially involved in that family member's care to then find where that family member is, to then be able to intervene. And unfortunately, after she arrived here in this area, my mother became ill. I was unable then to track where my cousin was. And to this day, I don't know where she is. I am so grateful, however, having the challenge that you have, that you are able still to engage your sister. And I commend you for the strength it takes to meet those challenges and to give that love. I love you for it.
I love you, Cheryl. Thank you so much for that. My heart goes out to you and your family because that's what peer support is. We know what each other has gone through or is going through, and that's what we do. Once you're in NAMI, it's a family. Once you have had this experience, you are part of the NAMI family. And I appreciate that. I really do. And it's one of the reasons why, initially I felt like, well, she doesn't really have a memory problem. Is this a issue with her rights being, not her rights being violated? Or should she really be, because she's very smart. She knows her rights. But if she's out, then I'm going to be like, I won't know where she is, and I'm getting older. I can't go down there 3 times a month anymore. So yeah, it's a complicated issue, but thank you for sharing, Cheryl. I appreciate it. Does anyone else have any question for me? My information is in the chat, so please feel free to reach out. And I do just want to say again that we're able to do a lot of our work because of the generosity of Prince George's County. Just saying that. And thank you, Health Department, Local Behavioral Health Authority. We work closely with the county. I see Gina and Denise here. Yes, and we really appreciate the opportunity to help wherever we can. So thank you for that.
Thank you so much for that, Ms. Moore. It's been an amazing presentation, and appreciate you sharing that personal story with us, and really glad to hear about the partnership with Luminous Health for ending the silence in the schools with the Maryland Consortium. Really excited to hear that coming about, and hope that it can really target that early preventative care, and it can get folks connected to resources better. You did mention the program leaders and the training that those folks go through. So I was just curious, is that something that the BHAG could refer members to, if organizations can refer members to that training program, or how you go about your outreach for those folks and the type of training that they go through?
Sure. We usually we're always conducting outreach, looking for volunteers and program coordinators. I mean, it's such a challenge, especially, I would say, especially in Prince George's County, because as most of you may know, because of stigma, and this is minority community, because of the stigma, that's that extra hurdle we have to go over. And also COVID kind of left people in a different place, not sure what they want to do yet. But yes, the BHAG can help by, if you know of family members who are impacted by mental illness and are interested in participating in a support group or facilitating a support group. The training is done by state. State does training for us. So we're, beholden to their schedule for trainings, and they're constantly doing trainings, and we're constantly looking for residents in Prince George's County who would be a good fit for those trainings. So if anyone's interested in facilitating support groups or teaching classes, those are two different things, or becoming a presenter, because sometimes people just ask us to come share our story. We tell them about NAMI, then we share our story, similar to what I just did. But there's also facilitators for support groups, teachers, and presenters. Those three categories. We're always looking for that. Yes. And of course, for any of the programs, if you're the person who's directly impacted by the mental illness, you have to be in recovery.
For that, and is it best to reach out to your contact information here in the chat for those?
It is, and I'll make sure you get to the right person. We have a program coordinator. You had asked me earlier about challenges, Taylor, and I would say that we're a small but mighty organization. Believe it or not, we're a part-time organization. We're 2 staff members, okay, that are part-time. But if you know anything about being an executive director of a nonprofit, it's not possible to be a part-time executive director, but that's me. But we plan on staffing up shortly because of the system of care opportunity. So we're also looking for staff in that regard. And we're going to be putting out a message soon about that, very, very soon.
Great. Thank you so much. We appreciate your time so much more.
I'll make sure you get it, Taylor, so that you can share it with everyone as well, okay?
Absolutely. And in the meeting notes as well, I have 2 PDFs that I'll share with the group. Some one-pagers from NAMI that has a little bit more information about their programming. So I'll be sure to include those with our slides, the meeting recording, and you'll have access to those one-pagers.
Yes, thank you. Yes, it gives more detail about the specifics of our signature programming. So if you have any questions, but I will leave you with this too. We do spend time trying to help individuals navigate the behavioral health system. Everyone knows that's a challenge. So if this group could help with identifying or kind of moving us in the direction of knowing who our vendors are in the areas of ACT team, in the areas of case management, that would be very, very, very helpful. Not only who they are, but actually what they are doing and what capacity they have to do more. Thank you.
Thank you. Any other reactions, questions, comments? All right. Well, thank you so much, Ms. Moore, for joining us this afternoon. It has been an honor and a privilege to hear all of what NAMI is up to and continues to do. So thank you so much for being a resource in the Prince George's County community. And please do let us know if there's any way the BHAG can continue to support you. Absolutely. All right. Thank you so much. All right. Well, we will go ahead and hop into some community announcements to finish us up for the afternoon. All righty. So first, we just wanted to share, I can put a link in the chat to this video. The Mental Health Association of Maryland a few days ago put out this short film, The Experiences with Mental Health Care in Maryland, really centering youth voices across the state and the importance of adolescent mental health. And that really encompasses so much of why we are here and gives impetus to the work that we are doing and will continue to do. So we'll be sure to put this link in the chat for anyone who would like to view this video and hear more community-centered voices. And that brings us well into a more exciting announcement coming from the Maryland Community Health Resources Commission. The consortium did award 129 awards for youth mental health across the state of Maryland, amounting for $111 million. It brings great joy to be able to announce that Prince George's County partners received 19 awards, totaling nearly $25 million. A special congratulations to all of the organizations here that were awarded, all 19 organizations across Prince George's County who will enter this space and do some really great work, hopefully, and will bring more resources. As JB just mentioned, the partnership with NAMI and Luminous Health being one of them, and just really excited to see what work is to come. So any reactions, or do we have any partners on the call who were awarded through the consortium? And we will be sure to put the full list of organizations who were awarded through this opportunity in the chat to view more. All right. And are there any other community announcements before we finish up for the afternoon?
This is JB again. I would just add that iMind, does mobile crisis, was giving an award for $350 million, and we supported its application per their request. Thank you.
And I don't know if Dr. Blunt is still on the line, but I was just going to check in with her to see if there were any policy updates. I know there were some hearings recently.
Hi. Yes, I'm still here. So in terms of what is now Senate Bill 124 and a cross-file House Bill 400, there has been hearings on both bills, one of which I testified in person and both of which I've testified in writing. We still continue to receive opposition from insurance companies. And for those who don't know, this is for advocating for an annual behavioral health visit in an effort of mental health parity and also mental illness prevention. So yeah, the only opposition has been from the insurance companies, and they are opposing on the premise that the collaborative care models already do this with the by administering screenings, and so there's no need for it. And they're also concerned that passage of such legislation would further exacerbate the issues seen in the behavioral health provider shortage
issue. So they think that people will begin to utilize the service, and to quote their language, people who really need it won't be able to access it, end quote. But we're looking to have some conversations with them to add additional language to the legislation, saying that nothing in this policy shall prevent the screenings that happen in collaborative care, and this can happen in addition to that. And so we'll see how that bodes with the opposition, and hopefully the bill will be able to progress through. The bills, because there are two of them now.
Yes, Ms. Cheryl.
Taylor, I'd like to let everyone know that we have been working in Annapolis on the 988 fund campaign. We are scheduled for hearings on a Senate bill 974 and a House bill 933. This will enact a surcharge of 25 cents on the telephone bills of Maryland residents, so that we can have a pot of dependable funding for the 988 crisis helpline number. So we're really excited to get it moved into committees, and then to start making our case as to why we got this service in place, and now we need to make certain that it remains in place, because it is very clear that this is an asset in terms of providing mental health services and mental health responses to those persons needing the mental health services here in the state, free of charge, of course.
Thank you for that update, Ms. Cheryl, and thank you, Dr. Blunt, for the policy update there. Do continue to let us know how we can get information out to the BHAG, and if there are any updates. All right.
Yes, thank
any
you
other
for asking about it. Appreciate it.
And are there any other community announcements or any updates? All right, I will bring us to our final slide. So if you would believe it, it is already time for our next Healthcare Action Coalition quarterly meeting. So this one coming up in March, it will be held virtually. We have a registration link that you can use to go ahead and register early and have that block on your calendar. We will be meeting on Tuesday, March 12th from 6 p.m. to 7:30 p.m. We'll get to hear from the LBHA, talk a little bit more about the Maryland Consortium that I feel that you are all just experts in at this point. And we'll do a check-in, have some open dialogue about adolescent mental health across Prince George's County. So should be a very exciting meeting on the BHAG front of things. And again, that is a virtual meeting that will be held on Tuesday, March 12th. We will reconvene as a BHAG the week after on Wednesday, March 20th at our usual time from 3 to 4:15 p.m. And before we hop off, any questions or anything before we log off? Alrighty. Well, thank you again. Thank you everyone for joining us. Thank you so much, Ms. Moore, for your wonderful presentation this afternoon. It is an absolute privilege to get to connect folks during these monthly calls and to continue awareness across Prince George's County for all the resources that exist out there. So do continue to let us know if there's any way we can support you or your organization, everyone. And other than that, have a wonderful rest of your afternoon, and we will see you next month.
Thank you.
Bye, everyone.
Thank you.